this foundation. We share a similar vision in promoting health awareness and community impact. Thank you.
Thank you so much. Okay, thank you so much. Now, it's my pleasure to introduce our speaker for today. Our session topic is navigating health information and self-medication in the social media age. Today's speaker is pharmacist Nimchi Jeremiah Taye, and she'll be taking us through this important and highly relevant topic. You're welcome, ma. Over to you. Over to you, ma.
Did we talk for group?
Pharmacist Ninchi Jeremiah Taye. Yes, ma. You are welcome, ma. And over to you, ma.
Okay, good evening, everyone. Please, can you confirm if you can hear me?
Yes, ma. We can hear you, ma.
Okay. Good morning, good afternoon, good evening, everyone. Wherever you're joining us from this beautiful world, I'm glad you're here. So once again, I'm pharmacist Ninchi Jeremiah Taye, and I'm the founder and executive director of Dubai Humanitarian Sports Foundation. So our organization is dedicated to transforming the lives of children and young people through education, climate action, and empowerment. And I'm also a pharmacist. So today, I will go at proudly because this conversation is one that speaks at the intersection of both. So I will speak both as a pharmacist and then as a member and executive director of Hepzibah Humanitarian Support Foundation. Please, can you confirm if you can hear me?
Yes, ma. We can.
I'll continue. So I would love to start with a story, and I know this story will sound so familiar to every one of us. So I want us to put on our thinking hats. Everybody put on your thinking hat. So I want us to imagine a mother. It's 2:00 a.m. She wakes up and then she finds out that her child has high fever. She's scared, and then she does not want to wake the doctor unnecessarily with phone calls at that moment. So she picks up her phone. What do you think she will do next? This is a generation of tech, right? And everybody is a tech savvy. Even if you're not, we have AI. So what do you think she will do? Yes, you're right. She will either hop on ChatGPT, she'll hop on TikTok, she'll hop on Facebook, she'll hop on Instagram to check. Okay, my child has high fever at night. Probably she will type prompts like a 2-month-old female child with high fever at 2 a.m. And you know, if you type that, definitely something will come up. But now it's beyond what comes up. If the mother in that state of confusion, anything that comes up will seem right. But then the problem is that she will have more than 10 articles that will come up at once. These 10 articles will be with different solutions, and all of them will say different things. And funny enough, all these articles, or more than 50% of these articles, will contradict themselves. And then suddenly she will see one post that has gone viral, and with over 2 million views. Let's keep imagining with her thinking hats on now. And then she now gets to hear a confident voice, simply with a very simple advice telling her, just give your child this remedy. I did it for my kids and then it worked. What do you think she will do? Probably the woman will say she had 4 kids, she had 5 kids, and then she did all this. She did that remedy for them, and then it worked. Then the problem is not the remedy in itself. What happens afterward? This woman will most likely find herself in the emergency room by morning, if not that night. What are we trying to say today? We are here to talk about. Please, can you confirm if you can hear me?
Yes, ma. I can hear you,
Okay,
ma.
I'm getting reactions to know that we are on the same page. So today we are here to talk about navigating health information and self-medication in the social media age. Okay, so we are not saying that all information on social media is false. Neither are we saying that all information you get on social media is right. Today we will dig deep together, and then we will realize how to go about how you can see every information that you come across. And you know, most times the people that are the receiving end are people that are not even medically inclined, because any information that comes their way seems right. I remember there was a time that we had this viral post, and I believe it came from TikTok. Personally, I'm not on TikTok, so I believe it came from TikTok because I kept seeing posts, even on WhatsApp. You keep seeing reshares on people's statuses. And then it was about boric acid. I think this should be around 2 years ago, thereabout. Personally, I think I've just seen that boric acid once. That is boric acid capsule. It's used for infection. It's good for a woman. She insert and all that. How it came about? It was from a TikTok video. Someone wanted to market his or her own product and then came up with different stories around it. And people, one thing with people is that they don't even take the extra mile to even get to know the side effects of these things, either medication or things they put into their body. When someone says it has worked for me, everybody believes it. So I want us to look at the numbers. You know, there is always statistics, because behind every statistic is a family, is a child, and then is a life. Most importantly, is a life. Every number you see online, it represents a human being. And then based on statistics, based on research, I got to find out that there are 3.96 billion people on social media globally right now. Because the truth is that even people in the remote area are on social media. They might not be on Instagram, but they are definitely on Facebook. I remember discussing with someone recently, and then the person was like, even in villages now, villages where there is no network, they have a particular spot, whether a tree, whether a mountain, whether a stone, that you see them gathered in the evening time. Everybody is pressing his phone. Everybody is on Facebook, getting to know what is happening, what is the letters. So everybody, or virtually everybody, is on the social media space at the moment. Every single one of them can create, every single one of them can share, and then they can amplify health content, qualified or not. And then the World Health Organization estimates that about 60% of health content circulating on social media contains inaccuracies. They are not verifiable. They are not things you can verify. See someone tell you that, okay, he had headache, and then all he took was orange. Probably it works for you because there was an underlying cause for your own headache. And then another person whose underlying cause is not the same as yours, you will mislead the person of not taking paracetamol, which is what we know that we should take when we have headache. And the person will take orange, and then it will land him into something else. Like I keep telling people, headache is not a disease. It just tells you that something is wrong somewhere. It could tell you that you have malaria. Headache could tell you that your blood pressure is high. Headache will even tell you that you're just stressed, and all you need is rest. You don't need any medication. it's not rumor, so not an opinion, but inaccuracies circulating on social media. In other studies, the number is higher. So one in 3 adults worldwide report self-medicating based health information found online. When you sit and discuss deep with someone, you cannot finish a discussion for, let's say, 2 hours with someone, and the person will not mention that, I saw this thing online. I saw this thing online. I saw this thing. Okay, I saw someone posted that this thing works, or this thing works better than this. This is even someone you don't know, and information you have not even verified. And then perhaps the most sobering figure is that over 200,000 deaths annually are linked to medication errors globally. Whether medication errors by self-medication, or by social media knowledge, or by them say, let's speak our language, them say. And the truth is that many of these are preventable. Many of them trace back to incorrect information. This even reminds me, just yesterday evening, I was with one elderly woman, and she was telling me that that her daughter has been having stomach pain, and then she went to the lab, and then they told her she should do some tests, but she doesn't have money for that test. And then this stomach pain comes to the young girl. The girl is just 5 years old. That it affects her just once a year. Then she has taken all medications she could take. And I asked her, Ma, have you taken your daughter to the hospital? Have you seen a pediatrician? She said, no, that she doesn't have money for that. You can imagine. I saw her with some herbs. So I asked her, what is this one? She said that it is a leaf, that this is a leaf that someone recommended. She told the person that her daughter has stomach pain, and the person said she should boil this leaf. It was guava leaf, that she should boil the guava leaf and then add lemon or so to it, and then give the child. Mind you, this could actually work. But then, what is the underlying cause? You understand? What is the underlying cause? So beyond what them say, beyond them say, what really is the underlying cause of that ailment, of that condition, of that thing that is disturbing you? We're not talking about minor inconveniences now. We're talking about a global public health crisis that is hiding in plain sight. Up as a wellness post, it is dressed up as a healthy, full friends share. Sometimes if it is someone you believe so much that will share one information, that I saw it on this person's status, so that means it's correct. In all this, let's always try our best to consult medical experts. Let's try our best to see the doctor. Let's try our best to make correct medical consultation before we take any form of medication or remedy at all. And then my pain most times is that children and youth are the ones that are most risked. Children and youth are the ones that are most risked. And then when we talk about children, you see, children cannot even talk. They don't even know what is happening. Anything their parents give them, they take. I think in the hospital a few weeks ago, I was discussing with a woman that her child is sick, and then she has given different antibiotics, and then the doctor recommended a higher antibiotic, or a different generation of antibiotics for the child, but it was expensive. Mother was even crying. I told her, Sima, just try and purchase this medication and make sure this child takes it, because he's a child, and if his body gets resistant to antibiotic at this moment, or in this point in time of his life, you can imagine what will happen to him when he's older. At that point in time, his body will not respond to all these common, readily available antibiotics. You have to start looking for antibiotics that you go to a different state. You have to import in order to make sure that just a minor issue will be sorted. At Hepzibah Humanitarian Support Foundation, our work centers on children and youth. And then when we look at the issue of health misinformation through that lens, the concern is even greater. Here is why. Children and young people today are digital natives. They were born into a world of smartphones, social media, instant information. You see a child of 2, 3 knows how to operate tablets, but he uses the tablet to listen to his ABCD rhymes every day. He uses the tablet to play games. So a child of 2, 3 years knows how to navigate his way on a tablet or in a phone. They are extraordinarily comfortable with technology. Being comfortable with a tool does not mean you can evaluate what it gives you. No, not at all. And then scrolling. Excuse me. Scrolling is not the same as thinking critically. The fact that you keep scrolling your phone up, or down, either way, it doesn't mean that you're thinking critically. So research has shown that self-medication behaviors in Nigeria begin at the adolescent stage, because young people are watching YouTube videos, they are following fitness influencers, they are sharing TikTok health tips, and making decisions about their own bodies, and then health based on what they see. Most times without any adult supervision. Okay, if your child is around you at home, or if a young person is around elderly people at home, it's better. But now you get to see that children at tender ages are at boarding houses. You see a child of 9 years is already in JS1 and it's in a boarding house. Boarding houses these days, they'll tell you your child is not allowed to come with a smartphone, but it's allowed to come with a tablet, and then the tablet is connected to the internet, so he can browse or she can browse. Imagine she has headache. What she does is check on ChatGPT. Okay, I have headache by the left side of my head, and it sounds like someone is pounding yam on my head. What could be the problem? ChatGPT will just say whatever thing you want to say. Or maybe just check on either TikTok, because TikTok is what is common amongst Gen Zs now. Say, check on TikTok, and then someone will say, my head was pounding like yam, and all I did was I took malaria drug. I don't have malaria, but because someone says she took or he took malaria, and the person is one of these celebrities that has so many followers online, you become comfortable with that. Self-medication behaviors begin at adolescence. And that is why we young people are having this meeting today, to enlighten ourselves. By the time we are enlightened, together we will make more impact, because my voice alone can't be loud for everyone to hear, not even in my vicinity. But if your voice is amplified, mine is amplified, and then we also take advantage of the social media space, we'll be able to educate our peers, will be able to educate people around us, will be able to educate people to know that not every information on social media about your health and about every other thing is accurate. And to probe it. Then there's something we must sit with. Health decisions made in childhood shape lifelong patterns. I've seen a child that I've seen a child that a child quite grown, not an adolescent, a child, maybe let's say around 4 or 5 years old, cannot walk properly. And what's the reason? That a nurse injected the child, and then it didn't sit well, and then it affected the child. The child's leg got paralyzed at some point before he started walking, and he can't walk properly anymore. So you can see all these little things, especially in childhood, it shapes lifelong patterns. That from childhood, his parents or his mom has taught him that anytime you have slight headache, what you take is malaria drug. He grows up with that, and he keeps spreading that gospel. Anyone that tells me I have headache, my mother told me that anytime I have headache, it's anti-malaria I will buy. And then by the time the person take anti-malaria, that whenever I take anti-malaria, I feel okay. And then you keep telling people to take anti-malaria even when they don't have malaria, and the day they have malaria, they are resistant to the medication that is supposed to have worked for them. So if a young child learns that at 14 years old that they can self-diagnose, they can self-treat, and happens, they carry that behavior into adulthood. Misinformation at this stage does not affect them today, affects the adults they become. And for many of the community that we serve as Hepzibah Humanitarian Support Foundation, we serve more in areas or communities where formal healthcare infrastructure is limited, where seeing a doctor means traveling a long distance. Oh yes, we have such communities. Stay in Abuja, and then recently my colleague was telling me that there's a community in Abuja that our villages, think of the most rural village you can think of, far better than it. Yes, in the capital city. So don't think that because you are enlightened, every other person is enlightened. Think that because someone speaks good English, the person is also enlightened as you are. So the slightest information you have, just learn to share it with someone. You don't know, you could be saving a life. Social media is the primary source of health information in those kind of areas, because once in a while, that is when they get to see a doctor around them. Once in a while, they have visiting doctors that come, or maybe when organizations, NGOs go to such regions or areas for outreaches, that is the only time. Is the only time they have for formal information. That's the only time they have to get formal information about their health. It is not a supplement. So health information online is not a supplement. It is the main cause. It is the main cause of all these health inaccuracies, health complications that we get to see today. Which means the stakes of getting it wrong are even higher in such cases. That is why we need to take this issue personally. And that is why as HHS, that's Hepzibah Humanitarian Support Foundation, it is part of our core mission. So I want us to recognize health misinformation now. How do I protect myself? How do I protect you? How do we protect people we love and people around us? These fake informations. It starts with knowing what to look for. Health misinformation does not always look obvious. That's the truth. It doesn't look obvious. When you see it, you don't even know that it is false. It's often dressed in a language of empowerment. It speaks into our fears, and then it also speaks into our, and it also gives us hope. Remember the story I started with? I started with the story, right, of a mother that her child had high fever at 2 a.m. She was scared. She was confused. She didn't want to disturb anyone. She didn't want to start calling the doctor by 2 a.m. And then her best bet was to just check her phone. Then that podcast or that video clip she watched on TikTok that had 2 million views spoke to her fears. Told her that the woman in the video said she had used it for her kids, for her 4 children, for her 5 children, and then it worked. That gave her a sense of confidence. That is what happens when we see information online. It gives you a level of confidence that you don't even care to probe. Say, if it works for this person, definitely it's going to work for me. I want to walk us down through the 5 most common forms we are going to encounter. That is forms of misinformation. For one, the anecdote pass as evidence. My cousin was cured by this. I lost 20 kilograms doing this. Personal stories are powerful. They are powerful. If someone told you that he lost 20 kilograms, and then you see the before, and then you see the after, you will not get to know what happened in between. Whatever thing the person tells you, since there is an evidence, there is a proof, it's actually true. Personal stories are powerful, but one person's experience is not medical evidence. Our bodies are different. Our body responds differently to different things. Our conditions are different. And what helped one person may harm another person. In pharmacy or in medicine, there's something we know as adverse drug effects. Simple as what's the name of it? Fancida. Fancida contains sulfur or sulfur. That's sulfadoxine. And then there are some people, there's species of people that react negatively to this particular component, that sulfur component, and whatsoever thing that contains sulfur, they will respond or react negatively to it. And then there's a disease called or a reaction called Stevens-Johnson syndrome. It peels off a person's skin. So imagine someone tells you that, okay, I took this medication and it worked for me, and then the other person that is hearing this particular narrative is someone that is allergic, or his body or sulfur drug doesn't sit well with it. The person will take, but not because the medication doesn't work in prevention, it doesn't work to prevent malaria, but because the person's body system is to a particular component, the person takes and then has Stevens-Johnson syndrome. Now, this is what we are talking about. But then if such a person meets an expert, a medical expert, the medical expert will talk with him, he will discuss with him, and will get, have you ever had any form of allergies when you took any drug? From there, they will discuss, and they say, okay, this medication is good, but it is not good for you. So that is why we say our bodies respond differently. Our bodies are different. And then what helped one person may harm another person. Number 2, miracle cure claims. Miracle cure claims. If something promises to cure cancer, diabetes, depression in 2 weeks, run, no, run. My brother, my sister, run. I don't really know of other parts of the country, but in the north, especially in the evening time, we have them around plenty. They will tell you that this medication, it cures HIV, it cures diabetes, it cures typhoid. One medication. In such cases, run. I don't even expect a literate to even patronize such kind of people. But then it's far beyond you as a literate. What about someone that is an illiterate? He's also a human being, and then his own life matters as well. So what do we do? That's why we are having this meeting today, to sensitize ourselves, and then to also see how we can join hands and also help another person outside. Medical science is extraordinary, but it is also methodological, and then it is slow. Genuine breakthroughs are announced through journals and institutions, not viral Instagram posts. Genuine breakthroughs in medicine, they are announced through journals, they are announced through institutions, and not viral Instagram posts. Not the one that you see something that is viral on Instagram, but you cannot verify. It's not in any journal. It's not, no institution can back it up. Nobody can verify it. Only on Instagram. Only your favorites, only your faves can tell you that, okay, it works, but then medically it's not proven. When you see such things, you should also run from it. And then we have number 3 now, misrepresented statistics. Numbers build trust. And then bad actors know this, and then they take advantage of that. We see numbers. Imagine I tell you that, okay, I have an invention. I just, as a pharmacist now, I just invented a medication, and then I'm giving it to everybody in my community. And everybody in my community that has taken this medication, I gave them three months ago, none of them have had malaria. None of them sleeps under mosquito net, but none of them have still had malaria. Imagine my community. My community is not small. It contains about 100 or 200 people, as little as it sounds. If someone else hears that, you say, if this can work for 200 people, I cannot be different. You can see how misrepresented statistics affect people. As far as there is number, people easily become prey of that information. They will take, and then these people will take real numbers out of context to create false narrative. They will always ask, where did this number, when you always ask yourself, where did this number come from? What was the full study? Who conducted it? Most times we don't even care about, as far as it works for these, 200 people. Definitely it's going to work for me. It will work for me. But then today we're learning something new. Whenever we hear such kind of information, the first question that should come to your mind is, number that these people are talking about, where is it coming from? Are they real human beings? Have been an AI generated? What is the full story? Who conducted the study? And if these information are being gotten, they are being verified, then it's something you can verified by a medical expert as far as the medical, medical related condition or medical related situation. It's something you can consider, not just out of the blues. You get to hear about numbers, you get to hear about people, and then you think that is it. And then number 4, outdated medical information. Outdated medical information. This evolves constantly. What was recommended 10 years ago may be contradicted today. So any content that is being shared online, any shared content online often has, or many shared content, in fact, almost all shared content online, they often have no date. You just see forwarded. I remember there was a post. Sorry, I give in so much stories. I remember there was a post I saw that someone is missing. Anyone that has an information of his relatives and all that should call this particular number. And someone now commented that this message has been circulating for over 3 years now. So for me, I saw that post for the first time. But then the person that commented had seen it even before then. So you see, not everything online, it's not everything you see online that you should just believe it. Because for me, when I saw that, I was being empathic. I was like, what happened and all that. And then the next comment was that this message has been reshared for over 3 years now. So every information you see, just know that it could have been a circulated message. It can circulate for years after it is no longer accurate. ACTs now, anti-malarials. Then if you have malaria, you just take normal artemether lumefantrine and you'll be fine. Then now people will even take artemether. The advancement in medicine now is that you can take artemether lumefantrine tablet and it will still not work, and then you might have to take injection. Or you will take injection. What happens these days? The treatment guideline is that even after taking injection for 3 days, you need to follow up with the tablet for another 3 days. It doesn't mean that the information we had years ago is invalid, but because medicine evolves, then there's an evolution of this information too. There's an evolution about this treatment guideline too. So anything you see online, you should learn to validate. Try and see how you can verify to ensure that it's not something that has been revolving, something that has been reshared from 1990 till now. And number 5, parental health advice. I've moved into an era where most of the trusted voices on earth are people with no medical qualifications whatsoever. But I think now we have people like, is it Aproko doctor? He's a medical doctor. Yes. There are quite a number of people that are medical experts that render medical information. And sometimes when they talk, people will think, this one, they're just talking. They're just like others. And let me hear another person that will be giving us pictures or figures that are not really true. So popularity is not expertise. And then follower count is not a medical degree. To get to, consume health information online, we have a lot of them. I've mentioned one, Aproko doctor, and there are quite a number of them, which I can't remember at the moment. Follow them. If it's medical advice, at least know that you're getting it from someone that is learned, someone that is grounded, someone that knows what he's saying. Not someone that just wakes up and then whatever dream he has, he believes is a medical intervention and begins to, spread it around. These patterns make you a more powerful consumer of information, and that power is something you can pass on, especially to the young people in your life. Now, I want to talk to you as a pharmacist. I just don't want to talk as an NGO leader or someone that is into the humanitarian space, but I also want to talk as a pharmacist at the moment. These issues does not only live in the abstract. It is something that we see, especially medical practitioners. It's something we see, whether in community pharmacy, whether in the hospital, we see it everywhere. And then let me just share some of the things I encounter regularly, especially in the community pharmacy. All these pharmacies we have around. You see a patient will walk up to you holding a printed screenshot on their phone, showing you photos, and they're asking for medications they saw that they were recommended on TikTok and Facebook. And most times, some of those medications are not even readily available in the country, but they will tell you that this is what they want. Particular medicine, they will show you photos. They'll say, they saw it online. This person said it worked for him, and then that is what they want. You see that or that. And then this medication may be completely inappropriate for their condition, or the medication may interact dangerously with what they are already taking. Because some people are taking medication, and as medical practitioners, we know that there are certain medications you don't take together. For example, a very common example now, medically will tell you that when you're treating malaria, don't take oranges. It's just one, and one of the most common ones. So there are other medications you don't take together, but people don't know that because someone recommends another medication, he doesn't know what you're taking. He doesn't know the treatment that you're already taking at the moment. He just recommended a medication, and then you on the other end, you don't know that this particular medication and this other medication can interact with the other one and then give you a very negative effect, negative side effect, or negative adverse effect on the other hand. So patients who have stopped taking so there are so many patients rather who have stopped taking prescribed medication because they read online that the big pharma is lying. Big pharma now is all these pharmaceutical companies, pharmaceutical industries. You don't need those pills, and then they come back later looking even worse than what they were earlier. So many people will tell you that all these medications that you take in the hospital, all of them, they have side effects. Yes, they have everything has side effects in this life. Even water, if you take too much of water, you urinate. I mean, so everything has side effects. If I will in pharmacy, I think in my 100 level, so we're told that all medicines are poisons. Does it mean I should not take medicine? No, it's the dose that matters. So, what especially these days, what people will keep telling people that all these medicines, so they have side effects. So let's do natural. Boil your pawpaw leaf. Go and get dogoyaro leaf. Go and get guava leaf. Go and get this. Take it. Or get pawpaw. Soak it in water for 3 days, and then you drink the water. You'll be fine. Anything that is disturbing you, that's the funniest part too. It will never treat a particular thing. If anything that is disturbing, anything that once you take it, you'll be fine. Please, I believe we are really digesting this information, and I believe that together we will be able to, educate other people around us on really. We are not saying that you have to take medication. All we are saying is that always have a medical always make medical consultation before you take any medication you're not sure of. Adding another medication to your medications, make sure you seek counsel, medical counsel. These two medications, do they go together? Can I take them together? Or the other one will stop the other one from working? Or just get the proper information. So we have seen parents as well. I've seen parents personally who come to demand for antibiotics for children who have viral infection. Today, this one is today that happened fresh. A woman came and then she needed an antifungal medication for her child that has a fungal infection. And then I told her it was not available at the moment. And then she was not asking me, you don't have any other antibiotic to give me? So I had to educate her. I told her, ma, this medication is not an antibiotic. It is an antifungal for a fungal infection. So even if I give you an antibacterial or antibiotic, it will not work for you. It will not work for the child. Rather, it will make the child. It will make the tendency of that child being resistant to the medication higher. And then one thing most people don't get to understand is that antibiotic misuse is one of the most dangerous trends in global health right now, because we are having a lot of antimicrobial resistant cases coming up. A lot of antimicrobial, you see someone is resistant to almost all the readily available antibiotics. We are creating superbugs. We are losing medicines that took decades to develop, and then it's taking decades to develop more now. But if we are not responding to some, definitely we need to have new ones. And then you just don't develop medicine overnight. It takes a while. And then another facet to this is people that are combining traditional or herbal remedies with prescription drugs. And then they will not even tell anyone. No. That is the funniest part. They will not tell you. They'll come to the hospital normal. Come like people that are serious. Can you confirm if you can hear me?
Yes,
Please
ma'am.
confirm. Oh, okay. Oh, okay,
Yes,
thank you. So you see these people, they'll come to the hospital though, as if they are really listening to whatever you're telling them. But after taking your medications, the one you give them, they have some leaves that they have boiled in their house. They will take. And then the thing is that some of these leaves, some of these herbs contain certain things that interact with other constituents in the conventional medications we know. So whenever we see people doing this, we should learn to advise them that they should do either of the two, not combining the two. Because some will even tell you that no, this one is just remedy now. This one is just herbal drink. It's not medicine. They do not do anything. But then the truth is that some of the combinations are lead out, some of the combinations are deadly, some of the combinations are very, very dangerous. These patients are ignorant. None of them are careless. They are people trying to do what is best for themselves and their families. They are trying to navigate the system that has flooded them with more information than any human being can reasonably evaluate. So when you see people are really leveraging on the social media for their health information, it's not really because we have people that are ignorant, but then not all of them are ignorant actually. Some of them are just, trying to look for information that's just information that any human being can reasonably evaluate. This one, in medical science, that one I will read it in paper, I will read it on the leaflet to tell me about the side effects, to tell me about the indication, to tell me about the adverse effects, to tell me about interaction. But this one, my herbal mixture, this one is tested and trusted. My neighbor has used it. It has worked for him. It has worked for her. So that is why even me, I am using. And I said something earlier. I said personal information or personal stories, they build trust. They easily build trust. So as health practitioners now, health professionals, our job is not to shame them from Googling. No. Our job now is to help them Google better, because in fact most of us here are tech savvy, but the truth is that the generation coming after us, we know now, they will know more than 50 times better. They will know far better than we do. So we cannot say that, okay, nobody should browse about his health or nobody should browse about medication. No, it's not possible. But what we are trying to do now is to help people be guided in browsing, be guided in listening to information online. Just like I said, we have medical experts now that have also jumped in, that have pumped into the social media space. They also give medical advices, they make videos, they make snippets, they make so many things online too. They also share posts online. And then I recommended that these are the people that we should listen to, because these are people that have gone through school, they've gone to school, they have been taught, they have understood, they are learned, they are professionals in the health sector. So it is better to listen to such kind of people. And And then with this kind of information, even after this webinar, and I believe that even you as an individual, the next time you're Googling information about probably your health, about your medication, there is a level of understanding you will Google with. Not every information you will hop on. I want to discuss something with us, the STOP framework, STOP, the STOP framework. And then, personally, in the course of preparation for this meeting, I was able to come up with a simple framework designed to be accessible to everyone, including young people, for navigating health information online. And then I call it the STOP framework, the STOP for STOP. So that's the abbreviation, STOP, STOP. Before you share any health information, or before you act on any health information, stop first. Stop. Now, source. What is the source of this information? Who created the information? Is it a qualified health professional? Is it a peer-reviewed journal? Is it a recognized health institution like WHO, CDC, what's it called? Yeah, NCDC, that's Nigerian. NCDC. I mean, yeah, or National Health Authority. Is it an anonymous account with catchy username and ring lights? The source matters a lot. Check it every time. Check it every time. When you stumble on an information, check it every time. Verify it. Where is it coming from? What is the source? By the time you stop, by the time you confirm the source, you now check the time. That's T. So S is source, T is time. We're talking on the STOP framework. When was this information published? Medical knowledge evolves rapidly. We have established this earlier. So guidelines from 2018, guidelines from even 2023, 2024 may have been updated or completely reversed by now. Every piece of health content you encounter should have a date. If it doesn't, be suspicious. So you just don't see an information, you say, okay, WHO say they have a new medication that once you take, you will never fall sick again. And then date, no date. Authors, no authors. Sometimes you will see authors, but then there's no date. As far as there's no date, there's no time. It's something that you should be suspicious about. And that is why every verifiable information you see online, you see a date, you see a time. When it's done, you see them in brackets. And then the O now, objective. S is source, T is time, O is objective. What is the purpose of this content? Is it trying to educate, or is it trying to sell? Is it trying to educate, or is it trying to sell? Is it creating fear or urgency to push a decision? Is there a product linked at the bottom? Whose interest does this content serve? Health information informs, and then misinformation manipulates. You know, this reminds me of COVID. I think it was COVID 2020 that people were bathing with salt. This was an information that began online that there's COVID now. Was it COVID? No, it wasn't COVID. It was but I cannot remember the ailment. It was eventually it was not something that became a pandemic eventually. Especially, it did not affect us much. It did not even affect us in this country. They say that everybody should bathe with salt. Remember, my auntie was with us in the house. She was the one that broke the news to us. Everybody was just bathing with salt. For me, that day I did not even bathe because I was scared. Let me not bathe with water that doesn't have salt, and then it's me that will die. And then let me not bathe with salt, and then some, because me, I know the implication of too much salt. You should drink salty water, and then you should bathe with salty water. So you can see this is a clear example of health misinformation now that originated from social media space. P now, professional. So S is source, T is time, O is objective. Now P, professional. Before you act on any health information online, especially before giving medication to a child, changing a treatment plan, or treating a serious symptom, consult a qualified health professional. Consult a doctor, consult a pharmacist, consult a nurse, as the need may be. Consult someone who knows your specific situation. The health practitioners are not gatekeepers of your health. We are partners in it. I want to say this again. Before you act on what you read online, please consult a professional. STOP, stop. Take this with you now. Teach it to people around you. Share it with the people in your community. Before I close and entertain any questions, so if you have any question, you can begin by typing them, sending them in. So before I close, I want to speak directly to every one of us. This problem we are talking about is enormous. This problem is enormous. But the truth is that it's not beyond us. Because every one of us in our own sphere of influence can make a difference. You could tell me that you're not a health practitioner. Oh yeah, you could tell me that you're not a doctor, you're not a pharmacist, you're not a nurse, you're not a lab scientist. You don't have anything to do with health. You could be a parent tomorrow. You could be a guardian. Start conversations with children. Conversation with your peers. Start conversation with people around. Start conversation with your neighbors. Conversation. People about where health information comes from. Ask them what they read. Ask them where they read it. Explore the information together. Make critical thinking about health. Make critical thinking about health information a family habit. Make it a personal habit. Make it a habit that you will influence other people to also inculcate into their own lives. And then if you're a young person, you are the most powerful agent of change in your own generation. You can become a health literacy ambassador in your school, in your community, in your neighborhood, even on your social media accounts. Resharing any information you see. Share relevant information. Share information that are verifiable. Share information that are actually true. Clean up the mess we have on the social media space. Our generation has built the internet. Let's help clean it. If you're a health professional, use your credibility online. You are needed there. Every video, every post, every comment that provides accurate information chips away at the wall of the misinformation. Every video, every post, every comment that provides accurate health information chips away at the wall of misinformation. If you're an educator, advocate for digital health literacy in your curriculum. Help students to evaluate what they find before they believe it. If you're a policymaker, framework we build now will shape how the next generation navigate health information. Include digital health literacy in your policy agenda. And whoever you are, use the STOP framework. STOP framework again, always get to know the source, the time it was published, the objective, then ensure that ensure that the source of that information is a professional. Share it, make it part of how you move through the digital world. And I just remembered that salt bathing something we were talking about. It was during Ebola, not COVID. It was Ebola. So before I close, finally, I want to leave you with something I believe is deep, or something that I deeply believe. I also believe that is deep, especially for us. This is not our enemy. No, 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 no. This is not our enemy. And the truth is that this is here to stay with us. This has saved us from smallpox. Read history, you get to know there was a time that people were dying from smallpox. It saved us from malaria. There were times that people were just dying from malaria anyhow. Science has even saved us from measles, because you don't get to see cases of measles everywhere now, because science gave us vaccines that one seems impossible. It is still science every day quietly is extending and improving human lives. This is, in fact, one of the humanity's greatest achievements. Information is not science's opposite. So you cannot say science is information are opposite. No, 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 no. It's science's greatest imposter. And imposters only thrive in the dark. So our job, all of us together, is to bring the light. And at Hepzibah Humanitarian Support Foundation, we believe that every child deserves to grow up with the tools to protect their own health. We believe that communities, when equipped with the right information, make better decisions for themselves and then for the community at large. And then if a community is well informed, it's just the matter of time. The global space will also be well informed. So we believe that on this Health Day commemoration, and every day, we are stronger together than apart. Thank you from the bottom of my heart. Thank you so much, CTA. Thank you for having us on this call. Thank you for having me. Thank you for collaborating with Hepzibah Humanitarian Support Foundation. Thank you for caring about this issue, because it is very relevant, and then for choosing to be part of this solution. Thank you, everyone, and happy World Day. Thank you.
Wow, thank you so much, Fahmi, for the insightful presentation. You took us through some stories about a mother that our daughter is sick, what will she do first, and also telling us to verify information online, and also the risk that self-medication can actually cause. Then you also took us through the STOP framework, which is source, time, objective, and professional. So before we make any medical decision, we need to seek professionals. We need to consult healthcare professionals. Thank you so much, Ma. And I'm 100% sure everybody would actually learn something valuable from the presentation, Ma. Now I will hand over to my co-host, who will take us through the question and answer session. Thank you so much, Ma.
Thank you so much, Ma, for the wonderful insight and the presentation. We truly appreciate it. So moving to the question and answer segment, on which we picked various questions from the chat board. The first question, which is, should there be rules or laws that stop people who are not knowledgeable from sharing incorrect health information? Did you get that, ma'am?
Sorry, I was muted. Yes,
Oh,
I believe there should be rules, because not everybody has the time to verify that information. But obviously, it might not be possible. That's just the truth. Something that might not be possible. So what we need to do now, as health practitioners, share more information. Because, if I have a cup of juice that is concentrated, and I have water, and I have plenty water being poured into the juice, juice will become diluted, right? And then if I have more of concentrated juice and little of water, and I have concentrated juice, more of concentrated juice being poured into the water will become concentrated juice instead of diluted juice, right? So as health practitioners, or as people that have insight about this information, people that are well well rooted in medical science, I believe we should have more posts online. We should be able to, in my as I was concluding, I also mentioned that we should learn to, as professionals now, we should post more online. We could make more videos. Let it get forget what you're doing as a health practitioner. Being online is also a plus for you and a plus for the people in your community. Yes, for me, I would say we should have rules, but then the truth is that the rules might not really suffice. So in that case, as people that are knowledgeable, let us have more information. Let us have more relevant information online than irrelevant ones.
Yes, ma. Thank you so much, ma. And the second question we have here is that, do you think social media is doing more harm than good when it comes to our health?
Well, I think it depends on who your followers are. That's that's what I can say. It depends on who you're following. I mentioned that we have a lot of health practitioners. There are certain things that, for me, I don't get to see on my social media space. I get to hear from other people, because the kind of people I follow online are not the kind of people other people follow. So what we are learning today is that let's follow the right people. And it is the people you follow that you see more of their information or more of their posts appearing on your feed. So to answer that question, I would say mind who you follow. Today, go out and unblock all those people that are feeding you with unnecessary information, and follow people that will definitely give you relevant information.
Thank you, ma. And the last one for the question and answer section is that, how can people spot unrelatable health information online or unreliable health information online?
Okay, I think in a nutshell.
Yeah.
Hello, Ife, can you hear me? Hello? Hello?
Yes, ma.
Yes, ma.
Okay, thank you. So I think in a nutshell, even if you've not gotten anything from all that I have said for the past 60 minutes, one of the things I kept emphasizing was that STOP framework. And if truly you follow it accordingly, if you follow it judiciously, you'll be able to identify informations that are not either true or irrelevant to your health. Framework. S, get to know the source. What is the source of the information? What time was this published? What is the objective of this information? With the way this information, the people are talking about, is it to gain more followers? Is it for them to sell? And then, who is the person that made this post? Is it a professional? So with this, I believe you'll be able to know which health information you should go with and which you should discard. So always remember the STOP framework.
That's the end of the question and answer section. Moving to the
Thank you so much, our speaker, for this enlightening session. And thank you everyone for joining us. I'm sure everyone has learned one or two things. And please seek healthcare professionals, seek professional help before you take medications. Thank you so much. Thank you so much, everyone. Thank you so much, Pamisi. Thank you so much, ma'am.
Thank you so much.
Now we come to the end of this webinar. Thank you so much, everyone. We truly appreciate everyone for participating. Thank you so much. We really appreciate everyone. Have a wonderful day.
Thank you. Enjoy your weekend. Bye.
You too, ma. Bye, ma. Thank you, ma.